Welcome to the program. Uh,
Hello, thank you.
um, I am so excited to have you here today because we often talk about direct service with one person at a time, but you're a big
Yeah.
systems thinker, and I love that you and I can talk about these different kinds of things that we do
Mhm.
with our individual clients, but at a bigger level. So, can you just tell me a tiny bit about yourself and how you got to think big like that?
Well, actually, I've always been more of a forest than a tree kind of person for the longest time. So, I mean, and it's interesting because when I got into counseling, counseling is a very individualistic thing, that was sort of like the focus that it always gave me. Even though they talk about social justice and stuff like that, I just couldn't see that connection because it was always focused on the individual, like you said. You know? So, what it was just a big disconnect until I started to learn more and got into a different theory, which was all about relationships, and it just finally clicked. And then, I sort of kind of regretted because the program actually had counseling and marriage and family therapy. And now I'm like, after the fact, I thought, "Ooh, I should have done a family LMFT program because that would have probably fit more with the person that I am, systems, you know? So that's
Well,
how I thought about this.
you ended up in the right place. You are Dr. Gustavo Salazar, and I'm grateful that you're on the program today. I'm Dr. Sue Hernandez, where we at Levelation level up from wherever we are. And
Yes,
our program today, we're talking about leveling up more than the individual at the entire community and societal level through
yes.
policy and practice. Um, so, can you tell us about a little bit more about this word trauma? It gets used a lot, right? But
Yeah.
that trauma, people don't really get it and they don't really understand how it could be for an individual and also a system. So, could you explain a little bit about systemic trauma?
Yeah, yeah. So, I mean, as practitioners, we see trauma at the individual level, but then we often forget and we take for things for granted that trauma can occur from, governmental policies, can be happening just cultural at the cultural level, can be happening at a hospital, the way they treat us, or they don't treat us. Uh, Trauma can occur because of poverty. Trauma can occur because of lack of resources or access to resources. So there's many levels that we, as individuals, we could be traumatized, not just by our immediate family, because perhaps they don't like, I don't know, we came out differently and maybe they beat us down because of that, but also because the way society, religion, at many different levels, we could be impacted and re-traumatized over and over again. So that's what systemic trauma is, not just you know, at the one-on-one connection, but with our government, with our resources, with access to the resources that we need as individual, like healthcare and whatnot.
Well, we've talked a lot about how um, your direct patient care and mine, for example, that we work with the individual, but then we have to teach them about all of the rippling effects of their stories and how all of society, community, institutions, school, family impact them and the
Yeah.
ripple effects out, right? So that it's both and all the time,
Yes.
everything everywhere all at once. How did you move from seeing all of these individual theories that we work with in learning how to be a therapist with your direct care and then apply it all the way out?
The actually the the theory that I practice is relational cultural theory, and that was a springboard that helped me realize how just focusing on the connections and how those really influenced, you know, me, right? Influences us, influences the people that we're taking care of. So I mean, when I approach, including in therapy, even with just EMDR, I try to go beyond what was happening at the individual level with the client, because then they could tell me, well, I have no access to this, and that's affecting, my relationship with my wife, or my family is treating me this way. So making the client aware how they, can be proactive in making those changes. So that way we could relieve stress, not just at the individual level, but you know, at the more macro level, So I try to approach it with them and make them more cognizant about how all that can affect them. You know. So there's a very interesting concept in relational culture theory, which is about images and how we think about how we're supposed to be. And I get the client, well, the client to think about how we are impacted with how we think we should be. How, for example, uh, how maybe perhaps a religion can force us to stay in a relationship when we don't desire to be in a relationship, and how that might keep us impacting us negatively. But that's because of the cultural dynamics, so there's many layers to the pressure a person can feel that could be impacted, and they should be aware of that, so that way they could also change. And I try to provide them that information so they could change with.
Well, walk me through what that looks like. Can you, what's coming to mind is yeah, just walk me through. Walk me through an exercise and how you do that.
It's just basically asking the questions as far as what's going on with your life. I know that we often look at the eternal family dynamics, but then I started looking at, well, do you have access to other resources? Healthcare. How is that impacting you? Or do you have access to as simple as transportation, right? And making them aware about, well, how are you being sort of kind of boxed in into something because you don't have access to a resource. So it's conversational again, and it's very organic in my discussion with the client. It's not, we just don't sit and start talking about everything that's going on all at once, but we sort of kind of move slowly, first from what's happening with the individual, and then what's happening with the family, and what can we do to address the family, and how then, if there's resources or lack of resources that are affecting them, then how can I connect you to other external resources so I can help you alleviate those stresses that still, can get you depressed. Like I said, it's organic. Like I had one client who was very depressed because they couldn't get help for his wife who was struggling with cancer. And I'm like, okay, well, I remembered my connection with Rotary because I talked with somebody who was in charge of the Gateway Clinic here in Laredo. So I approached that person like, hey, I have this client, you know, and they told me, oh, Gateway Clinic offers this financial support to help, additionally, when a client doesn't have the resources to treat like somebody with cancer, which can get very expensive. So it just came to that. And I just, connected with the client again. Hey, I got somebody for you who's going to help you, to explore all the financial uh, resources available to you. Long story short, the wife got help with cancer, and for the longest time, he didn't think that there was going to be. He was really depressed because he was thinking his wife was going to die. So I mean, it is a very organic information that we can live through the intake as well. So I mean, it's not just something that we just hit everything I wanted as we have that conversation with the client, which is very important.
So that's the client centered and out to community
Yes.
and really the institutions that impact that person's health. But if we work on it the other way, I was in Laredo when I went to go visit Pillar,
Uh-huh.
and I invited one of the clinicians there to go on a run. There were no sidewalks where we were running. So, what does that say about how we promote health if there's no sidewalk? And then when we did find a sidewalk, it was very narrow. So he ran on the sidewalk and I ran in the street because it wasn't actually encouraging these
Yeah.
protective mental health factors of community togetherness, right? Connection and belonging. So the community itself, even though it was in a beautiful neighborhood, just having no sidewalk says we're not promoting health of our community.
Yeah. 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 Unfortunately, it's not until we run across, situations like that, until we need something that we realize that, where the limitations are, you know. So I think oftentimes I think about those, again, going back to relational cultural theory, the connections that we have with people. Sometimes we forget we have those resources available to us. We know a lot of people, and then until somebody says, and they're like, "Oh, yes, I know somebody. I know a judge, right? I know somebody who could help promote something, right? And we can try to do something to, I through Rotary again. I bring up Rotary, but another colleague of mine has was recently. She ran for a position. I forgot for something for a committee something. Anyway, she was local and right, but I mean, she knows people. Right? I might not know everybody, but she definitely knows people, and I'm sure whoever she knows is connected to other people, So again, it's all relational, and we just, it's a very organic thing how we tend to push out things.
Well, when I first interviewed you about getting trained in EMDR, one of the things we talked about was how you could leverage your relationships in the community to help us build these trauma informed communities that create a biosphere of self propagated resilience. And that's like a bunch of fancy words to say just a community that heals itself, right?
Yes, yes.
And so one of the things you talked about was how we could leverage Rotary to help get the word out because you are so connected to people in influential places that are already educated, already connected, and able to get it out more effectively. And I think that has been one of the great ways that we've been able to see organizational change is to have you there. And then it
Yeah.
helps that you're related to judges and other people in influential positions.
Yeah,
So,
yeah,
can you
yeah.
talk a little bit about the that how you become an influencer in mental health space and resilience?
It's just about being active and actually recognizing. We go back to recognizing the resources that we have, those connections that we have, and saying, you know what, I could talk to them. The word influencer seems a little bit like it's daunting, but it's not. Anyone can be an influencer. And it doesn't require being able to talk fast or being able to do a presentation or anything like that. It just means, hey, I have a situation. I think, we could create some change. Maybe, do you know anybody, you know, and, and just talking to people, staying and maintaining those relationships and having those continuing, ongoing uh, conversations, because you never know as you start talking with somebody when they're gonna be like, "Oh my god, I know XYZ person," and then it's like, "Wow, what a small world." I kinda reminded back to, our own relationship and then how through mutual people, we realized like, "Oh my god, Lisa knows part of your family and her family knows part of your family." It's like, what a small world. So we don't know, until we ask. So anyone can be an influencer. You know somebody, you know somebody and you know that that person knows somebody else, and things can get moving that way, you know?
Okay, so if you're an influencer then, which I know you are, you
I
kinda know
try.
everybody, Gus. Um, how do we start, uh, measuring the change in each of the different sectors that you're starting to influence? Like, how do you see that coming together? Because I think one of
Sure.
the things we've talked about were like schools and housing and hospitals and nursing homes and academic institutions. And those are the things, the different sectors that you started to talk about. But realistically, it can be like there isn't any place that shouldn't be resilient, if that makes sense.
Yes, yes, and I think that requires a little bit more structure, and then recognizing one's own, what they do, like, taking advantage, yes, talking advantage, to people at Rotary, right? And then try to encourage them, well, who there can we talk to within your organizations to train them about trauma-informed care, making them aware, so they could start thinking about how could they apply that in their own organization. So, it's talking more about it. I do presentations, and I could certainly talk and give more presentations about them and invite. Again, it's inviting that leadership within the different types of organizations within hospitals, within schools, and other medical facilities, getting them to like, hey, I would like to give you a presentation on trauma informed care and train your staff or train, people. So it requires a little bit more organization, but it's a very, it can be done. You've seen our own skills to try to talk to people who are in those leadership positions so that way they can, try to implement and just, you know, continue doing that over and over again because, doing trauma informed, the implementation is an ongoing process.
Well, okay. So, um, if people wanted to contact you to have you come to a training for them as a trauma informed systems provider, how would they get in touch with you?
I would need to actually put my information out there, right? That would make sense. So, putting that information through, I could put it out through Rotary, right?
Okay.
Uh,
What
and,
are you willing to have people contact you?
yes. Oh,
Okay,
yeah.
what number or email or what's the best way to do that?
My cell phone number, 956-285-7246.
Hey, um, the next part about that is that a lot of times people don't think they have trauma, or worse, they don't want to feel like they're blaming their parents because their parents were good, but then something happened, right? Like their parents were good enough. And I'm always trying to tell them, your parents did the very best that they could. We're not blaming your parents. And I'm sorry that the child had to experience whatever they experienced, right? It's both and. Like, there's no way your parents would have wanted you to be harmed in any way. And yet that still happened. So when we do that with individuals, that's one thing. Systems often don't know that they are having a traumatic culture or that they are in a traumatic. So
And that,
how do you
and that,
address that?
that, that only way to address something like that is by being involved, by doing your part. It could be through, again, through trainings, presentations, through voting, right? Issues of social justice. It's just that continuous participation and education, you know, in order to create that change within the system. because as we notice, systems don't want to take responsibility for what happens, and creating change in a system can be very daunting, right? But if we all make that effort to participate, right? Then that's the only way we can start affecting change. In other words, we just can't sit on the sidelines with anything. And it might seem that, oh my God, do I need to get involved in politics or anything like that? It's like, no, 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 no. It's something, doing something, a small thing, and talking about it with what you're doing, raising funds, doing a small donation, all together, you know, like a band, we create music by all of us doing something, you know, and that's how we can create change. So I think the biggest message is don't be afraid of participating, even if it's something very, very small. Everybody and anyone can contribute, but as long as everybody's doing a little bit of something, that's where things can
I
happen.
totally agree. But at the same time, there are a lot of people that think that that small thing is huge. So
Yeah,
how
yeah.
do you get people comfortable just stepping out and letting them know that they do have a leader inside of them already? Like, they don't have to be a Gus who's already involved in all of these different things in the community. They just have to do their little part from wherever they are with whatever sphere of influence they have.
I go with back to my theory on relationship, because there's an aspect about growth fostering relationships, right? And it's about creating a very positive growth fostering relationship where the other person learns, right, through the relationship because of the way we're interacting. They feel energized in the relationship. They have an increased sense of self worth, right? They gain clarity and they learn things about themselves like, wow, I didn't know I could do this, right? And all of a sudden, you know, because you were in my life, now I get to do things, right? So, I mean, you've had a very strong positive influence in my life, and it's through our relationship. It's a growth fostering relationship, so it's maintaining those positive relationships where we're like, no, no, you too could do it. You might be a little bit scared, right? But I'm going to be there with you. We could do it, and keep on encouraging. That's the only way, because it's not going to happen in a vacuum. You got to nurture, the relationship, nurture that person, because not everybody is gonna, like you said, it's gonna be like, yeah, that's Superman. Well, no, it takes it it doesn't happen in a vacuum again. It happens within the context of interpersonal relationship, within the context of interdependence.
Well, okay, and I believe the same of you. I wouldn't have been we wouldn't have been able to get to the Texas judges as fast as we did if you didn't have that relationship with your cousin, right? And then we go and we present it to however many judges were there at that meeting, and that's just the beginning. We're still going from there. So you have strengthened me, the Via Foundation, got this Levelations ability to get out there faster. But I'm wondering, you're already an active member of the community. A lot of people would say, look, you have to pay me to do this work. But none of our advanced practice clinical leadership fellows are paid. We chose you all because each of you were already paying it forward in the community and you were already community leaders. So, how do we grow more of you?
Aren't you, Owen? Okay. I think that the kindness that we provide to the community, and continuing educating the community, and encouraging them. Not everybody is gonna participate, right? But I think letting them know about what's going on and encouraging that they too can make a difference. And just, just going on through that, perhaps that's something that eventually uh, might might encourage them to do something. I was reminded this morning about something that happened with NPR, and I was like, you know what? As I was hearing that, it's like, well, a lot of people sit on the sidelines. Why don't you, participate and help us out? Because now we're going to need more of you to help us out. And I was like, that's right. I went in and like, you know what? Let me give you $30 a month. You know, so I mean, I'm for just that recognition. And all of a sudden, when we don't have something and the continuing education, I hope that creates that motivation to make that change, even if it's again very little. So I mean, there's no. We hope that people participate, and our the best effort that we could do is try to lay the groundwork where people feel encouraged to participate.
People want to support themselves and each other in the community if they're given the opportunity. And one of my favorite things is having interns because I get to see them come alive and just say, "This is
Yeah,
what we're trying to accomplish. How do you think we should get there?" Because realistically, I learn more from them than they learn from me. I just
I
expose them
agree.
to situations.
Yes, yes, yes. And they don't know how much they can contribute to the relationship, right? So again, it's about fostering, a very positive relationship, so that way they feel that they have a sense of self-worth in what they contribute, right? So, and when they realize that, oh, wow, what I'm saying, what I'm doing is valued, what I can do can be valued, even if it's just a little thing, well, that goes a long way. And always as simple as saying to somebody, thank you so much for what you've done. I take that page away from you because you're always constantly, appreciating no matter how small the contribution is, because it provides a sense of value, and we feel value, more likely we're, hey, oh, yeah, I'm worth something. Let me keep contributing to that. Let me keep collaborating with that.
Let's come back to the Texas judges thing because we've kind of skirted around it and we teased people that we've talked to Texas judges. But what did we what did you do and what are you continuing to do?
Well, we opened the door, I guess. Uh, See, it's funny that we go back to relationships because, one of our other clinicians was already working with judges and stuff like that. One, and they was like, "Wow, okay, so I'm not the only one, right?" And my cousin, who is was elected judge here in Webb County, Laredo, Texas, and I when you talked about creating policy, I was like, yeah, I know somebody. It clicked again. It's like realizing that you have a resource and then being able to talk to them, to encourage them to incorporate trauma informed care. And then we start with doing a presentation so that way we could uh, uh, inform the judges about how trauma informed care, specifically through EMDR, can be very, very beneficial, be very, very quick, can be very efficient, and can have a lot of strong positive outcomes. And getting the judges to be in that mindset, like, oh, wait a minute, if we have a lot of clients who are doing better, then they're less likely to come back and be in court and get into trouble and all that. So it becomes something that they realize, wow, this could be great, this could be efficient, right? Getting that mindset. And then, you did the presentation, uh, with one also because you saw the judges as well. We were all there to show and demonstrate that, hey, so many, practitioners of EMDR are there to, show the judges. And then
Well,
the six.
during that presentation, the fascinating part was actually that the judges themselves came forward and said, "Hey, I'm in family court, and this could be beneficial for us to be helping the families, especially with reunification and with getting the parents who might have addictions into treatment and other kinds of opportunities for them to be working on, hey, what do I need to add to the court orders for families who were affected by trauma? Then you had the folks in the criminal justice courts, criminal courts, talking about sentencing and court orders. And then we had like all the different judges were talking about how it could benefit them to learn more about it so that they could use it in sentencing and court orders.
So since then, our goal is to try to continue informing them and providing them the list of EMDR qualified providers in the area, so that way they could contact them. And I think what's going to be the next steps is to continue again doing presentations with them, because since it's an ongoing process, hopefully eventually there's going to be more buy-in into it. So one of the ways that I personally decided to do a buy-in, I'm not involved in any of the work with Webb County Drug Court, but with adolescents. So one of the things that I decided to do is to take on one of the clients, even though I'm not involved with the program, and do NDR so I could showcase the judge. This is how this, client benefit from EMDR. And funny enough, as we start talking about the whole systemic things, the client is already talking about the bigger issues that trigger the client. So we're working on it because the client wants to go back to using substances so they could not feel. But as we've worked, the client has so far been steady. you know. So hopefully, there'll be a positive outcome and we could showcase that to the judge, hey, look what happened here. We need to find more, we need to get the rest of the MDR folks out there involved in this. So that way, you know, we could help you and then they do better and they don't come back to your court and they become more productive.
Well, and yeah, more productive, decrease recidivism, improve
Yes.
relationships, and really our goal is to just eliminate trauma as best as we can so people can
Yes.
be more resilient and
Yes.
less walking around wounded or traumatized and disconnected. So we can all get back to safety and connection.
And, doing all of that, reducing trauma and everything, I think would create a lot less eventual, hopefully, problems and criminal activity throughout the whole community where the community benefits as a whole, you know. So I think creating more awareness in the community as well, I think that's going to be a critical important, community awareness, educating them so that way they could help. They could be also our partners in pushing, trauma informed care, because if it's just us professionals, then but if the whole community is involved, like, hey, we want this, and it's like, oh, okay, I think we need to do this because there's more people saying that we need this, then I think that could create a stronger.
So you're also at a community based organization, Pillar, yeah. So, how have you already seen changes happening at your organization since you guys took on this model?
The biggest one is most of all of us here are practicing EMDR. We I think one of the next steps that we need to do as far as when you're asking about change is collecting more data, but we're seeing the changes at the fortunately at the individual level, right? But I know there's a positive change, right? Because when I talk to the rest of the practitioners, they often talk about their satisfaction about how quick they're able to help XYZ client, right? And then so we continue having that conversation and try to promote it again, making that extra effort and the promotion of it because I think we're still lacking in the promotion. Uh, but that's something that again, it's just having that conversation with our bosses and continuing them to, hey, we need to have that out there, right? And then as we start doing, programs, like we just held a program for our children, okay, it was all about resiliency. It's all about, managing their emotions. It was a lot of mindfulness and being present. But, having that component and integrating, trauma informed care into that component as well, getting the parents and telling, hey, this is also something that we could do and just continuously think about where we could put that out there, through because we always have more events. We have Halloween Fest, we have a fun run. There's numerous things that we do, and we could always put trauma informed care information in those programs. So that way we can keep spreading that information. And we have presentations to the high schools through UISD, LISD, Zapata ISD. So I mean that's something that we could just keep on integrating and hey, here's so that way, they could help us
Guys,
building those
that is
partnerships.
data. Guys,
Well, hopefully we
that is
can.
data right there, right? Like all we have to do is map it across the spectrum of prevention. You're already there and doing it, right? Like, what if at your community events that you teach people how to do a brave space there, right? You've already done click a resource in phase 2 of EMDR, right? And you building your partnerships everywhere. All we have to do now is map what you've already been doing. You guys had well, Laredo was a mental health desert for EMDR and lens neurofeedback before 2021. And you were in the very first group that was trained in lens neurofeedback. And then in our first cohorts that were trained in EMDR. And now you're saying you guys went from zero to pretty much the majority of your staff does EMDR now, right?
Yes, and hopefully in October we get three more. So there.
Yeah, we'll see. Maybe if Pillar will pay for some and we can give some scholarships through Be It for some too. But we need to be mapping this because if we're not mapping it and telling the story, then one, nobody knows. Two, we don't we don't show that we already have the model of what works.
Yeah.
And your leadership looks good when we tell the story of this data that actually has had positive outcomes, and leaders like to look good. So, uh, I just really want to appreciate you being on the program today. Dr.
Thank you
Gustavo
so much.
Salazar, he is a superhero in Laredo and way, way, way beyond. I'm really grateful that I get to call you a friend and that you
Sure.
are a fellow powerhouse that is willing to make change and influence resilience wherever you are.
I appreciate it. I appreciate it. And thank you. Because you I mean you're the rock where everything gets built upon.
It only happens with amazing people. If there's one thing you want us to remember as we're ending our program today, what's that one?
That you too can be an influencer. Anybody can. Look at look at what you have because you don't know what you have, but everybody has a lot. So You never know where we're connected with.
Love it. Everybody's an influencer.
Everybody's an influencer.
Influence whatever you can, wherever you can. I love that.
Without TikTok, there you go.
Well, I, Dr. Gustavo Salazar, it has been an honor and pleasure to speak with you today. You said
Thank you so
the
much.
phone number to reach you is 956-285-7246. If you are interested in a community event or a presentation about trauma-informed systems and how to make change for good, and even better, how to be an influencer from wherever you are.
Yes, yes. And then one thing about if you're gonna call me, text me first. Let me know. Text me first, so that way I could see it, and then we can have that conversation from there.
Okay, well, when your influencing becomes like mega star, you might want to change it to an email or something. But in the meantime, thank you for sharing your personal one. Uh, there is no better influencer than you right now. I am so grateful that I get to have the relationship with you. Thank you, everybody, for listening to our program today. I hope you will choose to lead from wherever you are and help us with Levelation, the Be Foundation, and Got This. Become resilient ourselves and influence change so that everybody can level up from wherever they are too. So that we can have resilient families, resilient communities, resilient societies, resilient institutions, and that we just get to be safe and connected forever. Thank you. Have a great rest of your day.
Thank you. Appreciate it.